Welcome back to the Rick Smith Show. Now, here is Rick Smith.
So the big news, and look, I think this is really important in this infrastructure plan, this budget reconciliation plan that they're going with. They're going to get health insurance to 2 million people in red states, and you go, why would Joe Biden do that? Why would he? Why would he vote? Why would he vote to and push to have people in states who voted against him covered? I would argue, one, because he's a decent human being, and that's what decent human beings do. But two, loves the country and not vindictive like the former guy. The former guy did everything he could possibly do to make the states that didn't vote for him more miserable. And you saw that in the SALT part of the tax bill. But here to share some thoughts on the healthcare part of what's going into this plan. Medicare expanding, dental, vision, hearing. Good stuff. Here to share some thoughts on this and also the expansion of some Medicaid. I've asked Laura Packard to come talk with us. Laura's a stage 4 cancer survivor and founder of Healthcare Voices. Laura, thanks for taking time for us.
Thanks for having me on.
So I don't want to steal Joe Biden's line. This is a BFD.
Yes. Since the Affordable Care Act was passed in 2010 and actually implemented in 2014, there have been many red states where low-income Americans have not been able to get health care because of conservatives in those states refusing to expand Medicaid. And even with generous subsidies included in the American Rescue Plan, they still won't do it. And so that's why there's finally good news that in the upcoming infrastructure package, there will be a federal version of Medicaid for those states for people that don't make enough money to get help right now, but can't afford health care.
Now, is this the beginning? Because, when I was looking at this, I'm going, what I wanted from the beginning was Medicare for all, and I'm very honest about that. But here, I'm someone who won't destroy everything to get the perfect. We got what we could get. But I also wanted, if we had to go this route, a public option. Is this the beginning of what could be that public option?
It could be, because this is another federal program like Medicare that's going to cover people in multiple states. And it'd be kind of ironic if Republicans in those states refused to expand Medicaid, screwed over their own citizens, and then that led to the birth of a new public health insurance program.
That would be almost poetic justice. Now, obviously, I got to question whether our Supreme Court would allow that, given how crazy it is. And I'll be honest, I was surprised that they let it stand. I was fully expecting them to chuck the whole thing. I'm glad they didn't. But how do you think this then, because this is clearly going to be another lawsuit and another revival of repeal and replace and all of that coming. How do you think that plays out?
Well, I hope that the Supreme Court is sick and tired of healthcare, just like the rest of us are sick and tired of having our healthcare threatened every year. I don't know what the courts will rule or when they'll rule it, but over 2 million people in states like Florida, Georgia, North Carolina, and Texas can't get health care right now. And these are the essential workers that we supposedly value. Well, we don't value them enough to provide them health care in places like Texas, apparently. But there have been people suffering and people dying without health care in all these years that their legislators just refuse to do their duty. And so now the feds are coming in.
Yeah, I mean, you look at where we started with our healthcare system, and right when the ACA passed, and I remember this story like it was yesterday. Within like a year of it passing, I met a couple who the husband hadn't had health care in years. They got an ACA plan that got them to be able to go see a doctor, and he was diagnosed with cancer. And they basically saved his life because he was able to get preventative care. And I remember that story because, you go, well, we didn't get everything we wanted. I go, but to that guy, we did, because that saved his life.
Exactly. And I'm fortunate enough that I lived in states that had expanded Medicaid. And so the healthcare systems in those states were stable. You see hospitals, especially rural hospitals, closing left and right in the states that didn't expand Medicaid because there's just no money to cover people who are uninsured. So it winds up affecting everybody when some people in your state can't get the care they need.
Now 2 million people is a lot of people, but we've got a lot of uninsured folks in this country. And I'm sure you're going to hear it from people. I've heard it already. It doesn't go far enough. What do you say to the argument that, this, it's all fine, well, and it's good. They've done a half measure here. What do you say to that?
Well, this is a start. And I think if we can get more than 50 senators to go along with something better in the future, I look forward to seeing that.
Yeah, that's a problem. I mean, even when Democrats had 60, they didn't get it. So in looking at this, because, of course, there are things that I would like to see happen. I've said, from the beginning, you take what you can get. And if this is what we can get, we take this now. And then we march forward. I would love to see the Medicare age drop down to at least 55 to get, old people out of the workforce and get them retired so the younger generation can take over. And also to lower healthcare costs for people. The number one, I talk to people all the time. The number one concern that people have are the cost of healthcare. And you look at the fact that, healthcare CEO, because the AFL-CIO just did their annual executive pay watch. And, in the healthcare industry, the numbers were just completely astronomical on what the CEO to worker pay ratio was. I mean, something like 300, I think like 250 to 1, 253 to 1. I mean, just a massive amount where you go, maybe we cut those CEOs' pay down a little bit, maybe raise those workers' pay up, and maybe we expand access for people.
Exactly. Is our healthcare system designed to make a few corporate CEOs rich, or is it designed to make Americans healthier?
Now, your group, you go around and you hear these stories quite often. As the founder of the Healthcare Voices group that you have founded, you got to have some real horror stories, but two, you got to have some ones that keep you going every day.
Absolutely. And my own story is case in point in that the Affordable Care Act saved my life. And without it, I would be bankrupt or dead. But I meet so many people that have been in my situation that they have an accident, they get a diagnosis, and thankfully they have the health insurance they need to still be here. But it didn't used to be the case. The AFL-CIO sent me to Arkansas in 2009, and I was one of the people on the ground helping to get the Affordable Care Act passed in the first place. And I met people all across Arkansas that declared medical bankruptcy or lost loved ones because of how broken the insurance markets were before. And I mean, they're still not perfect, but at least there is the ACA option for many more people.
Yeah, and look, I've heard a lot of the same stories as well. But the thing that I keep getting people coming back at me at, and it's not wrong. And this is one of those things where I'm going to agree right up front that the ACA has made corporate fat cats a little wealthier, that we haven't done enough to rein in those costs. There's a lot more to do. But what do you say to the people who go, look, you've expanded this, you're expanding more. It's just going to be just handouts to these big corporations.
Well, I think that we live in a world in which we have laws that are passed by Congress and signed by the president, and we can work to change who is in Congress and who runs this country. But with the deck that we have, this looks to be one of the best. This is a game that we can win at this level of stakes.
Yeah. See, but here's the thing, and this is, I used to believe that too, that, you get these bad politicians out. We've got the ultimate in term limiter. We've got the power to vote the bums out. but sadly, we rarely do. And especially I'm looking at these red states where, the horrible labor laws, lower wages, less health care, less retirement security, unsafe workplaces, all the negatives that you would have. And let's talk about health care, the fact that covered at much lower rates, and then, state government leaders who won't expand Medicaid, who won't help and get people the help that they need. And yet they're still getting votes. They're still getting people to put them back into office. That's just crazy to me.
Well, I think that most Americans don't follow politics day to day like we do. There are more important things on their minds. You can argue whether this should be the most important thing, but most people are just trying to get through the day. And so it's on us to reach out to those people and make sure they know that if their elected officials are bums, to vote them out.
Yeah, but here's the thing, and this is where I think health security is one of those things that's so incredibly important. In fact, today, I'm generally not someone who goes to the doctor, hardly ever. I've got probably the best health care that this country has to offer, and I don't use it very often. But today, we're on vacation. I think I had some swimmer ear kind of thing going on. I went to the doctor. I didn't think about, can I afford this? I went, I got taken care of. I'm better. I'm grateful for it. Cost, trouble, didn't cross my mind for a second. And for me, I want that for everyone. I want you to be able to go, you know what, there's something wrong. I should go have it looked at today, not 6 months down the road when it becomes a real problem. And I don't think we think like that I don't think we think like that enough.
Mm-hmm. Although there's more good news because not only does this infrastructure bill cover people that fall into the Medicaid gap, but also it strengthens Medicare, including vision and dental and hearing coverage, which is about time.
Yeah, why is it taking so long to do that? I mean, I remember, when my grandmother, when she was alive, we had to, start coughing out, thousands of dollars for hearing aids and dentures. And you go, explain to me why we can't use the buying power of Medicare to get better prices on this stuff. I mean, because after all, my view on the whole Medicare for all thing is the idea is it's a giant buying pool. It really is capitalism. It's one giant buyer, being able to buy in massive economies of scale. It seems sane and rational to me.
Well, I think since the Tea Party takeover in 2010 and so on, we just haven't had a majority in Congress and a president that cared about healthcare.
Yeah.
And now the stars have aligned and we finally do. And so that's why you see this one bill, the infrastructure bill, has every possible thing included into it because we don't know how long this moment will last where we can actually do some good.
So let's ask the serious question. How likely is it that this passes? There's some things in here that I'm thrilled with. Free college for community colleges. The PRO Act is still in there. There's a bunch of things that the eye and dental and the hearing for Medicare recipients, all great things. Not going to really matter if it doesn't get through. What are the chances of Manchin and Simina and Warner and some of the other more moderate Democrats coming along? What are the chances of that, do you think?
Well, the news that's come out over the past couple of days, it sounds like they've agreed on a number and everybody is on board with that. So that's a good sign. It sounds like the bipartisan infrastructure piece, the roads piece, or whatever that the Republicans are working on with Democrats, that sounds a little bit shakier, that the Republicans are starting to get cold feet, which is no surprise to you or I, because we know that the Republicans are not on the up and up when it comes to negotiations, that Mitch McConnell and his caucus will just pull something back as soon as you try to pick it up. But it sounds like the Democrats are on board with the human infrastructure piece, that they have a number and they have at least a rough outline of what it includes, and that we still have a long way to go. And there's going to be setting up legislation and votes on it probably right through September, maybe October or later. So we're by no means at the finish line, but so far, so good. And I think everyone is motivated to produce something because a lot of them are up for election next year and they need something to point to.
No,
so they're very motivated in that sense.
No, they've got to be, because I've said from the beginning, I've been saying this since January, if they don't get something big on the infrastructure front, if they don't get something substantial and visionary and transformational and all of those words, if they don't get something that's going to make people's lives better, 2022 is going to be a bad year.
Mm-hmm. And we live in a moment in time in which it's possible to do something. At least today, we could cobble up enough votes in the House and the Senate, even though it's going to be very tight because it's a 50-50 Senate with Kamala Harris as tiebreaker. And I think it's only 3 votes up in the House. So very small numbers, but we do have the raw materials to get there. We just need the will to do it.
Yeah. So the other question I had someone throw at me, does the squad derail this because they want more? Does that happen?
I don't think so. I don't think the moderates or the squad, the more progressive members. I think everybody is motivated to produce something, and there's going to be a lot of fights in the next couple of months to determine exactly what the final bill looks like. But I think at the end of the day, no matter where people's politics are, they are aligned with the idea of doing something.
No, we got to do something. We can't wait any longer. And in fact, there's some stuff in there about climate change that I haven't gone completely through, and I'm not 100% sure what it is. But at least there's someone thinking about doing something, because the Guardian had a story, I think it was yesterday, that said that the Amazon is actually emitting more CO2 than it's absorbing. We're in real trouble.
Mm-hmm. And we've only got this one planet. There aren't enough spaceships for Bezos and everybody else to blast off to a different one.
Yeah, I'm not worried about that. I read a thing the other day on how difficult it is to live in the space station, and how, there are no rich people going to space. They would never stay to that kind of a regimented schedule. Never gonna happen. But the hope is we get this pushed through.
Don't want that.
The hope is we get this pushed through. We get moving in the right direction, and we get something done. Laura, last question I got for you. What do you want people to do? What's the action?
Contact your senators and your representative and tell them you want them to vote for the infrastructure bill, and for it to include strengthening Medicare, filling the Medicaid gap, making the Affordable Care Act tax subsidies permanent, including home and community-based services so that seniors can retire in dignity and people with disabilities can get the help they need to live at home and not in an institution, and lower drug prices now.
All of the above. Laura Packard, I appreciate the time. Thanks so much. As always, great stuff.
Thank you.
Good stuff. Let's take a quick break. Right back after this. Stick around. You're listening to The Rick Smith Show. We're working people. Come to talk.
Remembering that united we bargain, divided we beg. Rick Smith.